Hair loss is such a big topic to be discussed on a reel. However, I'll try to highlight main points and we'll talk about it in two parts. So, hair loss or alopecia can just affect your scalp or your entire body, and it can be temporary or permanent. It can be a result of heredity, hormonal changes, medical conditions, or a normal part of aging. Anyone can lose hair on their head, but it's more common in men. So, baldness typically refers to excessive hair loss from your scalp. Hereditary hair loss with age is the most common cause of baldness. Some people prefer to let their hair loss run its course untreated and unhidden. Others may cover it up with hairstyles, makeup, hats, and scarves. And still others choose one of the treatments available to prevent further hair loss and cause regrowth. Causes. People typically lose around 50 to 100 hairs a day. This usually isn't noticeable because new hair is growing in at the same time. So, hair loss occurs when new hair doesn't replace the hair that has fallen out. Hair loss is typically related to one or more of the following factors. Number one, family history, heredity. The most common cause of hair loss is hereditary condition that happens with aging. This is called as androgenic alopecia, male pattern baldness and the female pattern baldness. It usually occurs gradually and in predictable patterns, a receding hairline, a bald spot in men, thinning along the crown area of the scalp in women, hormonal changes and medical conditions. So a variety of conditions can cause permanent or temporary hair loss, including hormonal changes due to pregnancy, childbirth, menopause, and thyroid problem. Medication and supplements. Hair loss can be a side effect of certain drugs, such as those used for cancer, arthritis, depression, heart problems, gout, and high blood pressure. Number 4, radiation therapy to the head. The hair may not grow back the same as it was before. Number 5, a very stressful event. Many people experience general thinning of hair several months after a physical or emotional shock. This type of hair loss is temporary. Number 6, hairstyles and treatments. Excessive hairstyling or hairstyles that has your tight ponytails can cause a type of hair loss called as traction alopecia. Hot oil treatments and permanent treatments at the parlor can also cause your hair to fall out. And remember, if scarring occurs, the hair loss is permanent. So, risk factors that can increase your hair loss. A family history of baldness on your mother's or father's side, your age, significant weight loss, certain medical conditions like diabetes, poor nutrition. So these tips may help you avoid preventable types of hair loss. Number 1, be gentle with your hair. Use a detangler and avoid tugging and brushing while combing, especially when your hair is wet. A wide tooth comb may help prevent pulling out of hair. Avoid harsh treatments such as hot rollers, curling irons, permanent straightening. Limit the tension on hair from styles that use rubber bands. So always tie in a loose braid. Ask your doctor about medication and supplements you might take that can cause your hair loss. Protect your hair from sunlight and other sources of UV light. Stop smoking. Some studies have shown an association between smoking and baldness in men. So this was all about the causes and preventive tips about the hair loss. In next session, we'll be talking about different treatments that are available to treat different kinds of hair loss.